Welcome to the Georgetown Bariatrics and Advanced Surgical Services Informational Seminar. We are really glad you're here, so come on inside and let us show you around.
At Georgetown Bariatrics and Advanced Surgical Services, patients are our #1 priority. From the moment you enter our lobby, your comfort, care, and safety have been considered in all aspects of our environment. Spacious hallways, a comfortable lobby, and large exam rooms allow our patients to move freely throughout the center with ease. We offer a state-of-the-art classroom for our educational events with individual desks and bariatric-rated chairs. You will meet with us one-on-one in the privacy of our exam rooms to discuss your specific clinical needs as you work towards your weight loss goals. Georgetown Community Hospital is known for the care and compassion we provide for our bariatric patients. From the time you walk into the hospital to the time you leave, your safety and comfort have been taken into consideration. All Georgetown Community Hospital employees and their associated clinics receive bariatric sensitivity training. Anyone who plays a role in your care will treat you with the dignity and respect you deserve. Bariatric rated chairs can be found in the front lobby of the hospital, our cafeteria, and all of our waiting areas. The radiology department features many modalities to care for your healthcare needs before and after surgery. This includes X-ray, a wide-bore MRI machine, a 16-slice CT machine, and a fluoroscopy room that can accommodate our bariatrics patients' imaging needs. Check out the Georgetown Community Hospital's website at www.georgetownhospital.com to learn more about the radiology department's accreditations and distinctions. On surgery day, your loved ones can wait in our spacious waiting area during your surgery. We have 2 state-of-the-art robotic systems and 2 robotic surgical suites to offer our patients the most advanced, minimally invasive surgery at all times. After surgery, guests are welcome to join you on the bariatric unit during hospital visiting hours. The rooms on the bariatric unit are private with a private bathroom. The nurses on the bariatric unit are ICU trained with specialized training in bariatric care. The patient ratio is lower, so you will receive more one-on-one attention. We look forward to seeing you at the clinic and the hospital.
My name's Denny Lair. 6 years ago, 2015, I had gastric sleeve done. I've lost over 300 pounds. I've fluctuated up and down. I generally carried between 275 and 320 most of the time, most of my life. I played ball and worked out all the time. Quit playing ball, and where I was working, I injured my back. My back injury got so severe, I ended up not working anymore. Went on disability, just sat there kind of self-loathed, depressed, ate more. Along top of that, my dad had Alzheimer's, so dealing with that. And eventually, he ended up passing. I just got to thinking to myself, hey, I was gonna be here, take care of mom, my sister, stuff like that. I was like, I gotta get myself back on track. So I got to looking and reading and decided to come to Georgetown, see what it was all about, and I'm glad I did. We'll discuss everything. We'll discuss like gain weight, loss weight. Last couple of years we've done the body fat analysis, so kind of keep track with that. It completely gave me my life back. If you definitely want to be around for the ones you care about, do it.
Now, I'd like to introduce you to your surgeon. Dr. Eric Smith is a board-certified, robotically trained, minimally invasive surgeon with extensive experience. He has performed thousands of bariatric and general surgery procedures. All of the bariatric surgeries are performed robotically at Georgetown Community Hospital. Dr. Smith is a national case observation site, and he is a mentor surgeon for Intuitive Surgical. He trains other bariatric surgeons throughout the country. Dr. Smith is a national proctor, speaker, and teacher for Intuitive Surgical in the specialty of robotic bariatric surgery. Dr. Smith has extensive experience and has performed over 3,000 robotic surgeries and continues to care for his patients using robotic surgeries to help them meet their weight loss goals.
Hello, my name is Dr. Eric Smith, and I'm the Medical Director of the Bariatric Program here at Georgetown Bariatrics and Advanced Surgical Services. I'm the Chief of Surgery here at Georgetown Community Hospital and the Director of Robotics for all of LifePoint facilities. We're really glad you joined us today to talk for the next few minutes about what we offer at our practice for surgical weight loss. Some of the topics we're going to talk about today are: what is obesity? Why surgical weight loss? And why specifically should you choose to have that here at Georgetown Bariatrics and Advanced Surgical Services? What surgical options we offer you? And what is the difference and why should you choose robotic surgery over traditional laparoscopic surgery or other options? And ultimately, how can you get started in this process? So first, let's talk about the definition of obesity. The CDC defines obesity as weight that is higher than what is considered a healthy weight for a given height. So basically, we look at something called body mass index, or BMI, as a screening tool for obesity. Your BMI is a person's weight in kilograms divided by the square of their height in meters. So a high BMI can be an indicator of high body fat. There's a variety of causes of obesity, one being genetic predisposition. Did you know that 25 to 80% of people who are obese have some form of genetic predisposition to contribute to that? There's environmental factors, how readily food is available, lifestyle, health habits, a sedentary lifestyle, things that are considered normal or abnormal in someone's daily routine and where they live and their cultural contributions. And then there's metabolic problems, believed to dramatically be reduced or resolved with a lot of the procedures that we're going to talk about today. We know obesity is a threat to our overall health, but what many don't know is these medical problems can be resolved with surgical weight loss. Pulmonary disease, fatty liver disease, gallbladder disease, gynecologic abnormalities, osteoarthritis, skin and gout issues are all impacted and associated with being overweight, as well as depression, stroke, gastroesophageal reflux disease, cardiometabolic syndromes, pancreatitis, multiple types of cancer, phlebitis, and ultimately premature death. So why should you consider surgical weight loss as an option to finally resolve your obesity? The National Institutes of Health, or the NIH, has given us a fairly clear continuum of care of how we should deal with patients who are overweight. Patients who have a BMI of greater than or equal to 25, which is just being overweight, we look at lifestyle modification, diet, increasing physical activity, and behavior modifications. When we take that BMI higher, up to 30, we look at pharmacotherapy or medications that may help these patients. When we get patients who are with a BMI of 35 or greater with comorbidities, or a BMI of greater than 40, we know that surgery is the most effective modality for treating these patients. So simply put, in the morbidly obese patient population, diet and exercise alone, with or without medications, do not work. For this group of morbidly obese patients, bariatric surgery is the only effective way to maintain substantial weight loss and is the only modality that has long-term proven success. The NIH recommends a multidisciplinary team approach and lifelong medical follow-up for these surgical weight loss patients. So let's quickly compare conventional methods to surgical options. Conventional methods would be things like diet, exercise, behavior modification, prescribed weight loss medications. These things tend to fail 95 to 98% of the time, and for the morbidly obese population, it essentially fails nearly 100% of the time. Surgical options for people who are morbidly obese will show somewhere around a 50% long-term success rate, meaning that someone 5 years down the road after surgery, 50% of those patients will still be out of that obese category and continuing to have long-term success. So why should you choose Georgetown Bariatrics and Advanced Surgical Services? We here at Georgetown approach surgical weight loss as a multidisciplinary program. We have a lifelong partnership with our patients for their long-term success. We've received multiple awards and accreditations, and we stay up to date on those at all times. So we've talked about having a multidisciplinary team multiple times already. We are surrounded by great dietitians that have experience in bariatric diets, diabetes, long-term weight control. We have 2 physician's assistants who focus solely on weight loss and surgical weight loss options for patients. We have certified bariatric nurses, as well as we have insurance, education, and intake specialists that work in our office with decades of experience. When patients are considering weight loss surgery, I always think it's important that they understand their normal anatomy before we start talking about the changes that we will make to it. So in the normal anatomy, food's going to travel from your mouth to your stomach via your esophagus, which is essentially just a very fancy food tube. The food will then travel into the stomach, and the stomach acts like a big washing machine. It's going to grind and churn the food and start to break it down before it starts being available for absorption. Once your food leaves the stomach through the muscle called the pylorus and into the small intestines, your body will mix it with enzymes and start pulling things out of your food, such as nutrition and calories and vitamins and minerals. Once the food leaves the small intestines into the colon simply reabsorbs the water from the liquid waste, turning it into solid waste so you can finally get rid of it. When we talk about weight loss surgery options, we kind of break them down on how they work. There's restrictive procedures, which is going to restrict the amount of food it takes to feel full. There's malabsorptive procedures, which decreases the amount of calories your body can absorb from your food. And then there's combination procedures, which basically just combines those two of both restriction and malabsorption to lead to weight loss. So here's the surgical weight loss options we provide for our patients here. The Roux-en-Y gastric bypass, the sleeve gastrectomy, the SADS, which is a modification of the previous duodenal switch, and revisionary surgery for people who have had weight loss surgery in the past. So let's first talk about the Roux-en-Y gastric bypass. The Roux-en-Y gastric bypass is a surgery that's been around for a long time. We by far have the most long-term data for this surgery. It uses a combination of both restriction and malabsorption. So remember what we talked about, it's a combination procedure. During the procedure, I'm going to create a very small stomach pouch. The intestines is then going to be divided past the duodenum and connected to that pouch, which will bypass part of your intestines that absorbs certain things from your food, including calories. As a result, patients are going to feel full sooner, and you're also going to absorb less calories. Having that smaller stomach and bypassing part of the intestines will ultimately lead to weight loss for a patient. So let's talk about some of the health benefits for Roux-en-Y gastric bypass. We know there's a whole list of them and far too many to talk about in this short seminar, but just a few. We have multiple studies that show that gastric bypass patients will experience a resolution of their type 2 diabetes, sometimes in a matter of days after having the surgery. This far outperforms any medication that one could take for this problem. Patients can have resolution of their high blood pressure, their high cholesterol, and resolve their sleep apnea and get off their CPAP machine. The surgery offers a greater weight loss in a quicker time frame, which helps you get rid of those comorbidities sooner. So what are some of the drawbacks to Roux-en-Y gastric bypass? With any surgery, there's risks associated, as there are with this, and one of those risks may be a leak. And although these are very infrequent, they exist and we have to be aware of that. You must avoid tobacco, anti-inflammatories, and steroids for the rest of your life if you choose to have a Roux-en-Y gastric bypass, because that can lead to problems with ulcers. Patients can develop things called dumping syndrome, where this typically only occurs when patients eat foods that we tell them not to eat, such as high sugar content foods. There's an increased risk of ulcers in the stomach, and you could possibly develop a small bowel obstruction down the road, although it's fairly rare. You cannot undergo a standard scope procedure to the old stomach anymore. And due to the malabsorption that we create to help lose weight, you must be on a special multivitamin and some supplementation for the rest of your life to make sure you avoid any type of vitamin deficiencies. So let's talk about what the impact can be if you have a Roux-en-Y gastric bypass. We're going to give you some example patients for all the surgeries we talk about today. So in this example patient, they're a 40-year-old female, they're 5 foot, 300 pounds. Their BMI is 58.58, and they easily qualify for weight loss surgery. After surgery, our patient is 1 to 2 years out. She's 5 foot, 125 pounds. Her BMI is now 24.41. This patient lost 175 pounds and 58% of her total body weight. Patients who have a Roux-en-Y gastric bypass can expect on the average of losing about 70% of their excess weight after this surgery. The next procedure we're going to talk about is a sleeve gastrectomy. Sleeve gastrectomy is a restrictive procedure. So we're going to create restriction to cause a patient to feel full quicker. During this procedure, I'm going to create a small sleeve-shaped stomach about the size of a banana and about the shape of one as well. This is also going to remove part of the stomach that makes what we call the hunger hormone, decreasing that hunger hormone and helping patients not battle with hunger in the future. The sleeve was originally done for the super high weight patients where we would give them a sleeve, help them lose some weight, and then take them on to something called a duodenal switch. And in the process, we found that this surgery was a great standalone procedure by itself. So what are some of the health benefits you can see after a sleeve gastrectomy? The list is many as before, but let's just talk about a few. Sleeve gastrectomy patients experience resolution for type 2 diabetes, high blood pressure, high cholesterol, and sleep apnea, fairly similar to what you would see with a Roux-en-Y gastric bypass. The procedure will allow for full absorption of nutrition, so the patient does not have to take special multivitamins, but we recommend that they're still on a multivitamin for the rest of their life. So what are some of those drawbacks to having a sleeve? There's always risks associated with surgery, and as with a bypass, there is a risk of a leak, although that's very low. There's a risk of developing new heartburn, or if someone already battles with heartburn, it could get worse after a sleeve, and if someone really battles with heartburn prior to surgery, a sleeve may not be the best option for them, and they should strongly consider a gastric bypass. This is a non-reversible procedure, and once that portion of the stomach is removed, that cannot be placed back in a patient down the road. So let's go back to an example patient after having a sleeve. This patient, before surgery, is a 35-year-old male, 5 foot 9 inches tall and weighs 350 pounds. His BMI is 51.68 and obviously qualifies for surgical weight loss. After surgery, our patient is 1 to 2 years out. He's 5 foot 9 and 170 pounds. His BMI is now 25.10. So this patient lost 180 pounds and 51% of his total body weight. Patients who have a sleeve gastrectomy can typically expect to lose around 60 to 70% of their excess body weight. The next surgery we're going to talk about is the SADS surgery, which is a modification of the duodenal switch. SADS stands for single anastomosis, duodenal ileal bypass with a sleeve. The SADS is a surgical procedure where we combine restriction with malabsorption. You get the restrictive power from a sleeve gastrectomy and the malabsorptive power from what we would do in an intestinal bypass, like in a gastric bypass. We maintain the pylorus at the bottom of the stomach as if you have a sleeve, but we bypass your intestines to help you malabsorb a portion of what you take in. So what are some of the health benefits of the SADS? The health benefits of a SADS are very similar to a gastric bypass. We'll see resolution of type 2 diabetes, hypertension, hypercholesterolemia, and many of those other comorbidities that we're trying to get rid of. When we do a SADS, we're preserving the pylorus of the stomach to give prolonged restriction, as well as combining that with bypassing the intestines to limit the amount of calories that a patient absorbs, and specifically fats. In a SADS, we oftentimes will see the greatest amount of weight loss in these patients compared to the other surgeries that we offer. So what are some of the drawbacks to the SADS surgery? Risk associated with surgery, as we've mentioned before, and specifically leaks, which we have to watch for and fortunately occur very infrequently. Due to the fact that we create malabsorption in this surgery, you must take a special multivitamin for the rest of your life. We have to watch out for any types of malnutrition and vitamin deficiencies and fat deficiencies as well, and the vitamins associated with that. Patients may have foul-smelling stools, frequent flatulence, or diarrhea if they take in large amounts of fats, and specifically if they eat foods that we're already recommending that they stay away from. So let's look at our example patient and the impact that we can have on them. This patient is a 50-year-old female. She's 5 foot 5 inches and weighs 285 pounds. Her BMI is 47.42. After surgery, our patient is 1 to 2 years out. She's 5 foot 5 inches and now weighs 135 pounds. Her BMI is now 22.46. She lost 150 pounds, 52% of her total body weight, and patients can oftentimes expect to lose up and around 85% of their excess body weight. We also offer bariatric surgery revisions, and these are procedures for people who've previously had bariatric surgery, either here or elsewhere, and maybe have not seen the results that they're hoping for. We offer gastric band to a gastric sleeve. We offer a gastric band to a Roux-en-Y gastric bypass. We offer band removal in general if a patient has had a band placed and doesn't want it anymore. We'll offer a gastric sleeve to a Roux-en-Y gastric bypass, a gastric sleeve to a SADS, or the modification of a duodenal switch, and overall gastric bypass revision, where someone maybe just wants to stay with the same procedure but has either had complications or suboptimal results. As with any revisionary surgery, we have to take all circumstances into account, and we would evaluate the patient's status and their medical history and the surgery they had previously, and make sure we guide them to the appropriate procedure for them and their success. So let's look at what kind of impact we can make in a surgical revision. Our example patient today is a 35-year-old male. He's 6 foot, 275 pounds. He had a sleeve gastrectomy in the past, lost a fair amount of weight, but unfortunately his BMI is still 37.29, and he's still battling type 2 diabetes. After surgery, our patient is 1 to 2 years out. He's 6 foot, 185 pounds, and now has complete resolution of his type 2 diabetes. His BMI is 25.09. Our patient lost 90 pounds and 32% of his excess body weight. Expected excess weight loss is much lower in revisionary surgeries, and it depends on where the patient starts and what surgery we revise them to. But as mentioned before, this patient now is diabetes free. So let's talk about why robotic surgery is the best option for you as you choose your surgical weight loss procedure. Here at Georgetown Community Hospital, we perform more robotic bariatric surgery than anyone in the state of Kentucky, and it oftentimes been in the top performers throughout the country. Robotic assisted surgery offers a minimally invasive surgery experience for patients. It also reduces the risk for complications, quicker return to full activity, superior visualization and dexterity for the surgeon. I can see inside of you in 3D and in HD and 10 times magnified compared to traditional laparoscopic surgery. And I have the same dexterity that I have with my own hands, where I have complete wristed motion, unlike anyone can do with laparoscopic instruments. We see decreased pain and blood loss, and it's the most advanced form of minimally invasive surgery available. In a nutshell, wouldn't you prefer your surgeon to see better, handle tissue better, always have a steady hand in doing complex surgeries for you? I always tell patients that there's 3 great components to successful weight loss surgery. 1 is a very good and successful surgery. 2 is learning how to eat right and healthy. And 3 is learning how to exercise. This is a tool that can lead to your success, but it has to be incorporated with all those other modalities. You'll need to incorporate a permanent healthy lifestyle, but diet and proper nutrition and exercise will all play a role in your success, but we will also teach you how to do those things and what they mean. Weight loss surgery is a journey and a lifelong commitment. It's a commitment between you and your lifestyle, and it's a commitment between you and us to help you get to where you want to be. But non-compliance with a healthy bariatric diet can lead to weight regain in the future. So here's what you're waiting for. How can you finally get started? You just took the first step in starting your surgical weight loss journey. So fill out a patient referral packet that we will email to you, and you should receive it within 48 hours of the email that we have on file. We will reach out to your insurance to verify what benefits they provide. And then ultimately you will be scheduled for what we call intake day. And our staff will review everything with you about the process leading up to surgery. You'll meet our PAs, our dietitians, and we'll set up all the other testing that's required to ultimately get you approved to have the surgery that you choose. You're now on your way, and the clinic and its resources will be supporting you for your success. So what can you do while you're waiting for this to start? Continue to research and learn about weight loss surgery. We have support groups that you can attend, and we encourage you to ask questions. There's lots of information out there, but always remember to verify it with us. Review the educational information that we provided to you. If you're a smoker or tobacco user, we need you to stop now. And if you can't do that on your own, reach out to your PCP to help you do so. We need you to stop smoking as soon as possible leading up to surgery. Start to get away from carbonation and caffeine. Remove the simple sugars and the empty calories. Drink more water-based, low-calorie beverages throughout the day. Start adding protein to your diet. Start to back up the food intake that you have. And any processed or unhealthy and fast foods, get those out of your diet as well. Take a multivitamin daily and maybe some extra calcium if you're a female. And begin to do some form of physical activity to your daily routine. And then when we meet you, we'll actually teach you what exercise truly is. Thank you so much for letting us teach you a little bit about what we do. The information on the screen gives you all the options of how you can reach out to us, and we look forward to hearing from you soon. I want you to know how passionate we are about taking care of patients and how passionate we are about getting you back to a healthier you.
My name is Peyton Wigglesworth. I had the gastric sleeve in May 2019. I started at 240 pounds and I'm now at 140 pounds.
So you're now at 140, and so that means you're probably within like 10, 15 pounds of your ideal body weight.
Yep.
Which that's all based on preference anyway. What's it done for you? What's it changed as far as, first of all, your health? Like, were you on any medicines, anything like that? Were you close to being on any medications?
Well, I had a lot of lower back pain, like a lot of really bad back pain. And ever since I've started losing the weight, I haven't had that issue anymore. So I've definitely had a lot more energy now, so I can go do more things.
How's it impacted your family?
Well, actually, my mom saw how successful it was, and then she got it done. So
Good.
a lot of people in my family are actually thinking about coming and doing it, or actually getting some help soon.
Right.
So
Good. So what else has it changed for you outside of just health problems or anything like that?
It has definitely changed my confidence, because I remember going school shopping. Oh, I hated school shopping because I would try on clothes, I'd get tore up because you just never could find anything ever.
Right.
And so I hated it so much. But now I can go out and find things that work for me, that make me feel good. I feel like I've gained more friends because I'm actually putting myself out there more and more.
Okay.
My confidence is just a lot better now. Yep, I feel a lot better.
So what do you do as far as to keep your result?
At my house, we have a really steep driveway, and I just got a new puppy. So he keeps me on my toes. I walk him a lot. My mom, she just had the surgery, so me and her actually do a lot of things together. Exercising in the garage, we have a treadmill, one of the weight machines. Trying to watch what I eat.
Okay.
Yep, and then I always come to my appointments. So.
Good. Do you have any regrets?
No. My only regret is that I didn't do it sooner. I should have done it as soon as I was old enough.
Right. What would you say to somebody who's wondering, gosh, thinking about it but not sure, or they're hesitant for some reason?
I think definitely just coming in and getting the information you need. Anyone who's asked me about it, I've told them, definitely look into it. It's worth it. Do it. If you can do it, go for it. As soon as I came in the first day, I met people, and I felt like so welcomed in, with Cindy and Heather and Jennifer and all them. Everyone here has always been super nice to me. So it's always been a welcoming environment.
Right.
And I immediately put my trust in. So
good. I say to people all the time, I think it's my job and it's our job to create an environment that you feel that comfortable. Because guess what? If this was easy, you wouldn't be needing help.
Yeah.
If we make you feel scared, you're just not going to come back. And then your weight's going to come back. And obviously, as you can tell, that didn't happen.
Yeah.
So,
thankfully.
yeah. No, you've done great. I mean, I'm really proud of you. I really am. That's awesome.
Thank you.
That's awesome.
Well, thank you, though, for doing that. I couldn't have done it without you.
Well, I did. It was part of it, but you put a lot of hard work in,
Well, thank
so
you.
that's why it's working.
We would like to introduce you to some of the team members you will be working with when you are a patient of Georgetown Bariatrics.
My name is Jennifer, and I'm the lead insurance coordinator for Georgetown Bariatrics and Advanced Surgical Services. The role of the insurance coordinator is to assist our patients in navigating through the insurance process. We want to make sure you're aware of every single piece of documentation, clerical and clinical, that is required prior to obtaining that authorization. We won't begin the process for weight loss surgery until we are sure that your insurance has benefits for weight loss surgery and that you meet that criteria. In the event that you have a bariatric exclusion, we do offer a private pay option. We do partner with a lending company that can assist you in obtaining those funds, and we will give you that information upon your request.
Hi, my name is Cindy, and I'm one of the dietitians here at Georgetown Bariatrics. And I want to talk to you about our services that we provide for our patients. We work with our patients to build partnership so that we can walk alongside you from the beginning through your pre-op diet, during your weight loss, and then finally how to learn to keep that weight off long term. So during maintenance as well. So here at Georgetown Bariatrics, we're going to work with you to provide education through classes, coaching one-on-one, whether you're a vegetarian, you're a diabetic, or you're on a certain specialized diet. We're going to focus on your needs as an individual, your lifestyle, and how you can pull these behaviors off in such a hectic, busy world.
I'm Leslie Salyer. I had the sleeve surgery August 2015, and I lost 65 pounds.
Okay. So you are 6 years out from surgery. Okay. What made you decide to do that? Why did you choose to have surgery?
I was miserable. I was at a point in life where I didn't want to do anything with my kids. I didn't want to go to the house. I was wearing maternity clothes from motherhood maternity for 4.5 years.
Had you tried other things prior to considering surgery?
Yeah, so I had done the diet pills, any type of yo-yo dieting. That was that chapter of my life constantly, but I wasn't accountable. So I didn't know how to be. I wasn't educated on the right foods or what calories in, calories out actually meant. So nothing was working because I wasn't working. I wasn't doing things right. So I needed something that, I wasn't going to say, oh, I'm just going to slip and have a piece of pizza over here, because I knew that with this option, having a piece of pizza wasn't an option. So I needed something that was actually going to keep me accountable.
Right. The surgery obviously is a tool and it helped you, but obviously you found something here that you didn't find in a subscription or a meal plan or a workout regimen that held you accountable. So it sounds to me like you feel like what we gave you here and the people is probably as, if not more important than the 30 to 45 minutes I spent on your surgery for you.
Absolutely.
Good. You just recently did what?
I just completed a half marathon. So I'm training for a full marathon.
Right.
It changed my life.
Is that the first time you've done that?
Absolutely. It's the first organized race I've ever been in. 5 years ago, I would have never thought that I would have ran any organized race.
So how's it impacted your family?
Well, my partner has also lost weight. He lost 60 pounds. And because it impacted how I grocery shopped and how we cooked and how everyone in the house ate. We're all very active and always outside, and it's just changed our everyday habits.
Right. How important do you think it is for just follow-up with lab work or just checking in for weights and things like that to kind of keep you where you are?
I think that I should have been more on top of that because you get this little honeymoon stage and you're like, yes, I've lost 65 pounds, I've got it from here. And then you lose, that accountability. I wasn't as accountable. So I did go up 20 pounds and then have to work that back off.
Right. So it happens. And we all make mistakes. You have any regrets?
No.
Nothing?
No. Everyone needs.
How about like that first week when you were nauseous or something you never thought, why did I do this?
Absolutely not. Good. I was so excited. All I could see was what I was going to be in 6 months or a year from then. So there was nothing that was going to make me think that I made the wrong decision, because where I was in life, how miserable I was a domino effect to everyone else that was around me. I knew that losing weight was the most important thing that I could do for my life. It wasn't just about losing weight, those behaviors that come with the weight that you're carrying.
Here at Georgetown Bariatrics and Advanced Surgical Services, we have a dedicated staff and use a multidisciplinary approach in caring for our patients.
We hold a MBSA QIP accreditation, and we are a Blue Distinction Center.
At Georgetown Bariatrics, we do not charge a program fee. All of our resources, materials, education, and support is all included.
Our nationally known surgeon, Dr. Eric Smith, is 100% committed to all the patients here at this clinic. All of his surgeries are performed here at Georgetown Community Hospital.
Here at Georgetown Bariatrics, you're more than just a number on a scale. We use the InBody to measure body fat, body water, and body muscle. In 60 seconds or less, we will have your results.
That's the end of our educational seminar, and I really appreciate you guys taking time to watch and learn a little bit about our program and what we can offer you as a patient. I want to leave you with a couple thoughts on what I really think you should be looking for in a surgical weight loss program. There's lots of programs out there, but 2 big points that I think you should really focus on are these. Number 1, a program that's a comprehensive weight loss program. Unfortunately, some programs have one procedure and that's all they offer, or some programs may be very limited on what they're able to do for you. There's not one right surgery for all patients. There's not one right way to fix a problem. And so you need to find a program that can do multiple types of surgeries and have multiple modalities to help you become healthier and ultimately lose weight. A program that's equipped to deal with other issues that arise from previous surgeries, whether it be revisions or retweaking a surgery that someone has had in the past. And lastly, you need to find a program that you can form a true relationship with. This is a lifelong relationship that you will have with your bariatric team. This is not something that you're going to see a surgeon, heal from your surgery, and kind of do your own thing. We always say that lifelong follow-up leads to lifelong results, and short-term follow-up will lead to short-term results. You have to follow up with us for the rest of your life to make sure that you're doing the right things. And the only way that you're going to follow up with your bariatric team is if you feel comfortable coming to them no matter what you're dealing with. If you've gained a little bit of weight back, you can't be afraid to tell us about it. If you're struggling with something, whether it be exercise or food choices, you can't be afraid to let us know. And so my hope at our program is that we will always create an environment where you feel comfortable and you feel safe to approach us if you're doing well or if you're struggling with things along the way. Please let us know if we can help you, and again, thanks for all the time that you gave us.